Dr. Michelle. Oh, thank you. Let me see. Okay. So I'm going to go ahead and turn it over to Dr. Michelle. Dr. Michelle Chang, she's a DVM MPH, is a public health veterinarian at the Los Angeles County Department of Public Health. She's the lead veterinarian for the animal importation response in the Veterinary Public Health Program, as well as for key aspects of rabies control and rabies exposure management. Now, before working in public health, she worked in small animal practice. She also received her veterinary degree from UC Davis and both her bachelor's degree and master of public health degree from UC Berkeley. So we're super excited to have her here. So Michelle, I'll go ahead and let you take the floor.
Hi, everyone. Thank you so much for having me. Let me share my screen. Right. Everyone able to see my screen?
It's still black.
Not quite. Here we go.
Yep. Yes, ma'am.
All right, perfect. Thank you again so much for having me. If you have any questions, please feel free to put them in the chat and we'll address them later. So today my outline is I'm gonna talk to you guys a little bit more about what the rabies virus is, some epidemiology about what it looks like globally in the United States, some rabies regulation resources. I was invited from someone from PAC that was from Virginia, Fairfax County. So I just wrote a little bit about that specific area, and I'll talk a little bit more about the rabies rules, and then also talk about rabies post-exposure prophylaxis for humans if you're ever exposed. So just an intro about rabies, right? Rabies is a virus. It's RNA, it's enveloped, and it's a lyssavirus. So because it is an enveloped virus, it means that it's kind of like, if you guys remember flu and COVID, right? It has an envelope on it, which means that things like detergent, any of your Lysols, your Clorox bleaches, anything like that is really going to, it's fragile in the environment. And so it can be easily killed that way, even though rabies is the most deadly virus ever. It is a lyssavirus, which is the group of viruses that cause this rapid progressive encephalitis to the brain. So while there are countries like Australia that say they are rabies free, they do have bat lyssaviruses, which cause a very similar disease to rabies. And so for certain lyssaviruses, the rabies vaccine is actually what you use is for post-exposure as well. So with lyssaviruses, they are neurotropic, meaning that they like your nerves and their final destination is going to their brain, to your brain. Rabies is one of the oldest known diseases, actually. So you will find references to it in very ancient texts, including the Sumerian laws, and even in these Mesopotamian dog incantations. And really, the domestication of dogs and our relationship with dogs and how we've, domesticated them, brought them to all the different continents, really also helped spread the virus. We do think that rabies did start in old world bats and then spread to different vectors. And so, what are these different vectors or these variants of the rabies virus, right? And so, these are animals where the virus is maintained in a particular reservoir host. So, for example, you will hear about bat rabies, dog rabies, raccoon rabies, skunk rabies, or like the fox variant of the rabies. So all of these variants, they're all the same rabies. It's just that that particular species in that part of where you may be is the animal that is what is the host for it, and other animals can get it from there. So, but all of the variants can infect any mammalian host and can cause disease, right? So that's just called viral spillover. So the bat could bite the raccoon and give the raccoon rabies, and then the raccoon can bite the human, and then the human will also get rabies. So it doesn't matter as long as you're a mammal, it doesn't matter where it started, who gets it, it's the same rabies everywhere. And so the canine variant, the dog variant of rabies, was eradicated from the United States in 2007, right? But this is still the major variant in the world. This is why some of you guys might know there's a CDC program where they look at imported dogs, and there's a lot of rules for imported dogs. And this is why it exists, because we could import back in the dog variant that we eradicated in 2007. So, how do you get rabies, right? So, the transmission of rabies virus is really the direct contact between broken skin or mucous membranes with rabies infected tissue like brain, spinal cord material, or some type of fluid like your saliva, right? So, um, the any of these fluids or tissues that goes into broken skin or mucous membranes can potentially give you rabies. The most common way for this to happen is really through animal bites, right? Because saliva does have the virus in it. So, bites are going to be the most important, significant way worldwide that people and other animals end up getting rabies. The question always comes up about, well, what about scratches, right? It is possible that, like, if there is saliva on an animal's nails and then they happen to scratch you and the saliva gets into your skin, yes, that is a way that you can get rabies as well. It is much less common. Bites are still going to be the number one way of how people die of rabies around the world. There are some cases of human-human transmission, right? There has been cases of organ transplantation, and one that was pretty recent, actually. And then there was a paper about mucosal transmission, but these are not as common as animal bites are still going to be the number one way of how rabies is transmitted. I put exposure to a bat because bat bites are very small and they oftentimes don't leave any marks, right? So just looking at this photo right here, you can see like you would barely be able to see that. So any contact that you actually have with a bat could be an exposure. This doesn't mean that if a bat is just flying around in a room, you guys were all awake and you saw it and it never touched anyone. That's not an exposure. But these are significant because we see a lot of this happen in the summertime when like kids are at summer camps and they wake up with bats in their cabin, and then kids are going to need to get your rabies post-exposure prophylaxis. So bats are really a significant source of rabies in the United States. Clinical signs of rabies in both humans and animals, it's pretty non-specific at first, right? So at first it can look like anything, like a person could just be vomiting, they could have diarrhea, they could have pneumonia, like nothing that necessarily screams like, ooh, I think that's rabies. However, over time, neurological signs will appear. And that can be like ataxia, seizures. In some dogs, we've seen things like drop jaw, and then the whole hypersalivation, right? The like foaming at the mouth. It's because sooner or later, you're not going to be able to swallow. In human and animals, your throat muscles are going to become paralyzed, right? And then you're not going to be able to drink water. So you're still producing saliva. You can't swallow it. So you're going to be foaming at the mouth. Also, we always talk about aggression. So aggression, it's not always aggression. Sometimes it's like animals who are nocturnal will come out during the day. But if you do see aggression, it's not just bites to humans, right? These animals will also be like a zombie-like, right? They will bite inanimate objects. They will bite other people, right? They are going to be behaving very, very oddly. Now, there's a variable incubation period. The incubation period is basically the time of when you were exposed, right? Like the time you're bitten and when are you actually going to develop rabies. This is very confusing, and my next slide will go through it. And it also doesn't help except cause more anxiety for people. So I'm going to go through why this incubation period is very variable. But I do want people to remember the hallmarks. Rabies is pretty much 100% fatal in humans and animals once clinical signs start to appear. It's also very rapidly progressive once clinical signs start, and animals and humans with clinical rabies do not get better. However, before clinical signs appear, and if you were exposed to rabies, there is prevention and you can be saved. So that's very important. So I'm going to talk about the pathogenesis of rabies and why it's the way it is. So first, you're going to get a bite from a rabid animal, or another rabid animal bites a healthy dog, right? There's a bite from a rabid animal, And then the virus starts replicating in that damaged muscle when you were where you were bitten, right? And this virus gets to decide on its own how long it wants to kind of replicate in that muscle. But that's also really important because if you are bitten by an animal, it's really important for you to really rinse out that wound. So I'm talking about like 15 minutes of rinsing out that wound because if the virus is in the saliva, and you can wash out a lot of the saliva, you're pretty much washing out a lot of the virus and decreasing your chances of getting rabies. So once the virus decides that it's done replicating in the muscle, it's going to find a nerve and basically enters that nerve and then starts traveling to the brain. They did some experiments that show that it moves about 10 centimeters per day, right? So these two big things about how the virus kind of replicates in the muscle from weeks to years and then traveling up, that has to do with why the incubation period is so variable, right? Because if you were bitten on your big toe compared to right on your cheek and the final destination is your brain, right? The incubation period from your cheek to your brain is going to be way less than from your toe to your brain. And then once the virus enters the brain, then your clinical signs are going to start to appear. Then the virus will enter your salivary glands and then your saliva. And then this is where transmission can occur through a bite. So the incubation period, right, the time between you were bitten and when you actually get rabies is estimated to be between 10 days to years, and it's variable because of all of these things. But the most common is weeks to months. So before you get clinical signs of rabies, if you can get post-exposure prophylaxis, quote unquote, the rabies shots for yourself, you can prevent yourself from getting rabies. So globally, what does rabies look like? Rabies is still a huge issue around the world. There's about 70,000 annual deaths. Children are disproportionately affected, right? They are more likely to go up to dogs and animals and be bitten. Dog bites, that canine rabies variant, the one that we have eradicated from the United States, is still the main form of rabies that kills people. CDC lists over 100 countries as high risk for this particular variant, right? And on this map, you can see it's basically every country that's red still has it. So many countries, though, who have eradicated the canine variant, like the United States, we still have wildlife rabies. And then also just remembering like rabies epidemiology of where it is, it can change, right? You can introduce variants through animal importation or movement, right? Even with us, we can move like raccoons from the East Coast on the West Coast and can potentially introduce raccoon rabies onto the West Coast. If there's public health complacency, any shifts in political and economic stability of a region, or natural or man-made mediated disasters can also cause it, right? So anything that where wild animals who have rabies can be more in touch with humans, that can make the rabies epidemiology change of a place. So, in contrast, right, where globally we're seeing 70,000 deaths, in the United States, we see less than 10 cases reported per year. And this is usually from rabies caused by bat bites or foreign animal bites, right? Someone went and traveled to a country that had dog rabies. They were bitten by a dog. They didn't think much of it. And then they came back and ended up having rabies. And why is it so different, right? Because after World War II, we had laws put in and stray dog and canine vaccination and licensing programs were implemented. However, from the 1940s till 2007, it took that much time and billions of dollars for us to actually be able to declare ourselves canine rabies variant eradicated, right? So this is a huge public health success, but it's also very difficult and it was very expensive. So you can see how certain countries may not be able to do this as well as we did. So even though we were able to eradicate the canine rabies variant, we still have wildlife rabies in the United States, right? Bats, raccoons, skunks, fox, the mongoose in Puerto Rico, and the USDA will do oral rabies vaccine baiting annually in certain parts of the United States to just kind of keep it looking that way. We're not going to eradicate wildlife rabies. We've already accepted that. So in the United States, it's estimated about 100,000 people receive rabies post-exposure annually. So post-exposure, I'm going to talk about it at the end, which is like the series of vaccines that humans get to protect themselves. However, we get 1.4 to 1.6 million rabies consultations a year. So in Los Angeles County, I do a lot of the consultations. I was on call on Monday and I got 24 rabies calls just about consultations, right? And that's pretty usual for me in the summertime. Compared to globally, though, right, 29 million people get rabies post exposure annually because rabies is still a huge problem in many parts of the world. All right, so what does rabies in wildlife looks like in the United States? I do want to just point out this map is showing terrestrial rabies variants. So, animals that walk on land, your foxes, your skunks, your raccoons. Bat rabies is not represented. Bat rabies is in every single state in the United States except for Hawaii. Hawaii is rabies free. However, even these states that have this white color, they still have bat rabies. Every state has bat rabies. So you'll see, so when the USDA does do oral rabies baiting, they really just try to do it along the edges to really keep the map looking like this. We don't want, this raccoon rabies in green to be over here on the West Coast. We don't want this spreading outward. And so we have accepted we're not going to eradicate wildlife rabies, but we can keep it looking pretty similar every year. I just put, so for state laws in general, every state pretty much has some type of rabies laws. I used Virginia just because the person who invited me to this talk was from Virginia. But California, for example, we also have from the California Department of Public Health, we have very, very similar rabies laws. Every state has something pretty similar. So rabies laws are not at the federal level. Each state kind of has their own, and then rabies, how to enforce the laws really goes to that local jurisdiction. And local jurisdictions may have laws that are just a little bit different than the state. They might be a little bit stricter, but they're pretty similar for most states, right? So veterinarians and other people working with animals, but especially veterinarians because they do have to follow these state laws. Practicing in any state, they really should be familiar with the state and local laws, right? So, what are the bite reporting laws and the regulations? Like, who do you report to? How do you report them? So, in some states, they just say, like, physicians have to report versus everyone who knows someone who got bitten has to report. That's what Virginia and California, for example, and a lot of states will say anyone with knowledge of a bite, you have to report. Animal bite quarantine laws and regulations, they're all pretty similar. There might be some nuances. And then how to get an animal tested for rabies is going to be different per county, for example, like who do you call? And then rabies vaccination laws can be a little bit different. So, for example, in Virginia, both dogs and cats have to be vaccinated by law, by the state for rabies. In California, it only says dogs need to be vaccinated, but local laws can say that cats need to be vaccinated. So some of the rabies vaccine laws by state can vary, like what rabies vaccine brands are allowed. Do you guys allow rabies vaccine exemptions? Can you use titers in lieu of vaccination? Who can give rabies vaccines, right? So depending on the state veterinary board, sometimes the veterinarian's the only one who's allowed to do it. Sometimes RVTs can do it. So these are some nuances to laws that people should just be familiar with. And then just saying again, right? You also need to follow the rabies vaccine label. And then the laws and regulations can be different per state, but they're pretty similar. And then I also just put the person who invited me was from Fairfax County. So they have, more specialized rules so that people should be familiar. Don't just look up your state rules, but also look up the county where you are. The big picture, though, why are all of these laws in place? Why are we doing bite reporting? Right? It looks very complicated. These papers are just so long. They're written in laws. Why is this happening? The big picture is all of these laws and bite reporting laws. It's really to prevent people from dying of rabies, right? When you get a bite report and you're reporting, you report, what the animal was, what happened, who was bitten, things like that. It's so that the rabies control authority in your area, we can answer the question, okay, based on what you're telling me, did a potential rabies exposure occur? And the next question is, If yes, that happened, how do we get this person that was bitten treatment as soon as possible, right? That is why you're doing it. It's really to prevent you from getting rabies. Because remember, rabies is 100% fatal, but it can be prevented with prompt rabies post-exposure prophylaxis. So time is of the essence. And the most important question to ask if determining whether or not you had a rabies exposure is where's the biting animal right now, right? That biting animal holds the key of whether or not you had a rabies exposure, right? If that animal has rabies and you can either test it or quarantine it, you can make decisions about your own health with 100% certainty. So if the biting animal, this is quarantines are for domestic animals, not wildlife. Wildlife must be tested. If these domestic animals can be monitored for signs of illness, so that's what the quarantine means, or tested for rabies, and it's or tested because rabies testing is post-mortem. Animals do need to be euthanized because the test is on the brain. Then rabies post-exposure prophylaxis decisions can be made with 100% certainty, right? And they're equivalent. If an animal passes quarantine, that is 100% certainty that the bite wasn't contagious for rabies, or testing them and determining whether or not the animal had rabies. They're equivalent in making decisions about your health. So I just pulled up, if you Google your county, your city, and just look up rabies, rabies still happens very often locally, right? So just in Fairfax County, they've been pretty busy. They've had some cat rabies. There was a coyote that was recently attacking residents and it is potentially rabid. And in Los Angeles County, if you look up things, we have a lot of bat rabies. In different parts of the country, you'll see cases of skunks, there's sea otters, and all of these things. So there's still quite a lot of wildlife rabies in the United States. And if you just Google News it, you will see it. One of the reasons I was also giving this talk was because there are animals that are being imported into the United States from those countries that were highlighted in red. And these are animal care facilities that are approved through CDC. Los Angeles County, where I work, we actually have two. We're the only airport that actually has two. And then there are other airports that always also have them. These are per the CDC regulations. And why is that? It's because dogs that are coming in imported from those countries that still have that canine rabies variant, it is a 16 times higher incidence rate of rabies than versus what's domestically acquired in the general US population. So if you do live in an area that has one of these animal care facilities, right, these are where these dogs would be coming in from. And I just pulled up some data from the last 20 years of the imported rabid dogs in the continental United States. We do see that all of the ones that were brought in, the own status were rescue dogs. But what's really important to note is like, look at the number of humans that needed rabies post-exposure prophylaxis. So a question I get from a lot of people is like, well, if we already have rabies here, like why do we have to have these extra laws through CDC for imported dogs? And it's really important to think about, right, the relationship that we have with dogs. Like if you saw a skunk, for example, that was acting weird on the streets, it's more likely that you are probably not going to approach it and more likely to call animal control than try to handle the situation yourself. But if you saw a dog that was like injured or a cat that was injured, our relationship with pets is so different that we are very likely to go up and try to help it and not necessarily call animal control, right? We are very likely to bring it into our home, and multiple people in our family are going to try to help feed and things like that. And that's why for dog rabies, it's a really, really big deal. And this is why humans will need more post-exposure in those situations because more people will touch and try to handle these animals. In 2004, Los Angeles did have a rabid dog come in. But it's really important to also notice that when these dogs are imported into the United States, they're usually multi-jurisdictional, right? They go into multiple states. And it's also really important to know that to investigate one of these cases for any rabid dog, even if it's not imported, if it's domestic, it's a lot of resources for public health. And this is technically your tax dollars. So it's really important if we can prevent it, we can prevent doing a lot of these things, and we can prevent a lot of people from needing post-exposure prophylaxis. So the difference though, right? I was just showing about like Fairfax County where there's like cats, there's bats, there's coyotes, things like that. In other countries that are high risk for the canine rabies, right, we see a lot of stray dogs test positive, right? These are places where people will go on vacation potentially. And if you're not familiar that, those areas are high risk for rabies, people may want to pet these dogs. In addition, right, puppies, right? Puppies can have rabies. We see that. Kids are dying from it. During the Ukraine and Russian war, Ukraine always had rabies, but because of the infrastructure is also being broken down that way, rabies is now an increasing threat in the front line region. So just one of the examples of just any type of disaster, either natural or human made, right? We can accelerate the threat of rabies in those areas. And then also really important, right, is like pet dog bites in areas where there's a lot of rabies. Even pet animals can get rabies and people can die from it. And then you'll see, right, here's another one, bite from a pet dog. Here's another thing where a daughter of an ex-IAS official dies of rabies after being bitten by a vaccinated pet dog. So while there are many rabies vaccines out there and many in many countries are very good, there are also rabies vaccines around the world for pets that are not good. And that's why when imported dogs from those areas come in, one of the CDC rules is that they have to be revaccinated with a United States approved vaccines, right? Our vaccines are tested and they are very good. So, in general, right, what are just some things that people working with animals should do to protect themselves? And this is not just from rabies, but from bites and things in general, right? Proper animal handling is really important, right? Observing that animal's body language, using your proper equipment, asking for help, right? If you think you may not be able to handle this animal by yourself, ask for help to prevent bites. Use proper protective equipment. I think a lot of us think that sometimes, we can handle it ourselves and we just read it wrong and then we're bitten. That's very common, right? Take that extra second to really do proper handling. And then any animal that is sick, seek veterinary care for sick animals, right? So signs of rabies, for example, can be really non-specific. Any sick animal should be evaluated by a veterinarian, and veterinarians should be aware if like an animal is imported, for example, or was, had an encounter with, a skunk or a fox or a raccoon or a bat. Um, Report things to CDC if any of these imported animals are sick, or report to, your state or local health department if there really is a situation with rabies. And also really important for any disease, not just rabies, right, that can transmit to other animals, isolate the animal away from other animals. For bites, right, report the bites to animal control. So that's either your local public health, your animal control, or your city. Animal bites to humans are usually legally reportable in almost every state, but you have to know who to report and how to report. Remember, physically move that animal to another area for quarantine away from other animals and notify other staff so that they're not bitten as well. And then when you notify your rabies control agency, they'll put on an official quarantine on the animal or give guidance on the next step. And humans who were bitten, right, seek medical attention for your bite wounds. Make sure you do clean them out as well. And then for people who regularly work with animals, consider and talk with your healthcare provider about pre-exposure rabies vaccination. So like you can be vaccinated before a rabies exposure. Being pre-vaccinated doesn't mean that if you do have a rabies exposure, you don't need post-exposure. But as I will discuss in my next slides, you will need less of it and it will make it a lot easier. And facility owners, also be aware of where your employees can receive post-exposure by discussing with local public health. Sometimes it's only emergency rooms that need it, right? This can be a workers' comp situation, talking to your insurance, things like that, because bites really do happen if you work with animals. All right, so I've been talking a lot about what this rabies post-exposure prophylaxis, also known as PEP, is. So what exactly is it, right? So it's a regimen recommended for people who had a potential exposure to rabies to basically prevent you from getting clinical rabies and dying. This is done After a potential rabies exposure, it should be done as soon as possible after a possible rabies exposure, but it can be done as long as the person has no clinical signs of rabies. This is something where there's a lot of misinformation online where you'll see things like you have to get it within 7 days of the bite, or you have to get it within 10 days. There'll be all these numbers. You should get it done as soon as possible, right? The earlier the better, but you can get it done as long as the person has no clinical signs of rabies, then it's not too late. It's considered a medical urgency, not an emergency. And then it can be post exposure can be started, for example, while the animal is under quarantine or pending rabies testing. And then if the animal is negative or passes quarantine, you can safely discontinue post exposure. So there's 3 steps to post-exposure. Step 1 is that wound washing. That is incredibly important. Step 2 is something called human rabies immune globulin, and step 3 is rabies vaccine. So I'm going to go through each one now. First step, wound care, right? This is a thorough wound cleaning irrigation. I'm talking about 15 minutes under the water, using water, soap, and if possible, also using like a iodine solution, right? I want you to get all of the saliva out, like really, really rinsing that wound. It has actually been shown that just wound washing alone can decrease the risk of rabies without other medical treatments. That's how important it is to get that saliva out. But also, right, like if you're able to get the saliva out and wash away things, you can also wash away like bacteria and chances of other infections. And then, right, your healthcare provider should also think about like, do you need antibiotics? Do you need a tetanus vaccine, pain management, and other wound care needs? Step 2 is when you start administering the rabies biologics. So the biologics, there's just 2. You're going to do human rabies immune globulin and then rabies vaccines, and they're 2 different things. First one I'm going to talk about is human rabies immune globulin. This is given to people who are not pre-vaccinated. So most veterinarians are pre-vaccinated for rabies, and we don't need this. People who are not pre-vaccinated for rabies, you are going to need this. And so this is basically preformed antibodies that you're going to basically borrow, because after you're vaccinated, it takes a little bit for your own body to create antibodies. And so during that lag time, as your body's making its own antibodies, you're just borrowing some extra antibodies that were preformed so that it covers that lag time. This is based on body weight, and it's only given one time. Ideally, it should be given on day 0. So day 0 should be as close to the bite and wound care as possible, but day 0 is defined as the day that you actually start these injections. So if you are bitten, it's really important that this immune globulin, which is preformed antibodies, is going to be infused around the wound, right? Remember the slide where I was saying the rabies virus replicates in that broken tissue? You're going to want to put it in that broken tissue so it can neutralize the virus on the spot. And then there are some rules that, like, if you do need this, a lot of physicians don't regularly give rabies post-exposure prophylaxis in the United States because we don't see it as much as different countries. So many physicians may not have given it before. And so these are just some rules that they should follow. I did say do not give to someone who has been pre-vaccinated for rabies prior to May 2022. CDC did change their recommendations on pre-vaccinations in 2022. And some people who were pre-vaccinated after May 2022, if you don't align with what CDC says, you may need to actually get immune globulin, even if you were pre-vaccinated. But that's something to talk with your healthcare provider for. In general, if you were never vaccinated, you do need to get this. All right, and that's just one time that you get it. Then the rabies vaccine, right? This is given in your arm and you get 4 doses of it. If you're immunocompromised, you should get a 5th dose of the vaccine. So your deltoid arm is really the only acceptable muscle for that vaccine in adults. Children can also get it in their thigh. There's only 2 brands of the vaccine in the United States and they're interchangeable, right? So there aren't that many that you can choose from. This vaccine cannot be given in the gluteal muscle. It's actually a decreased immune response, right? So remember, if you're going through this and they're putting anything in your gluteal muscle, you need to take a step back and think what's going on. This vaccine can only be given in your arm. So this is just a summary of if you did need rabies post-exposure prophylaxis, what it would look like, right? And so this is for people who are immunocompromised, they'll need that extra thing. So it's not that complicated, but this is a 2 week process, right? And depending on where you live, so first, rabies post-exposure prophylaxis can be incredibly expensive, even if you have insurance, right? Because you may have to pay copays. It's not every hospital, your primary care might not have it. They may make you just go to the emergency room. So, depending on how busy your emergency room is, you have to go 4 times. And if it's super busy and you're not going to be an emergency compared to, a heart attack, a gunshot wound, things like that, you could be waiting in the emergency room for several hours and you have to go back 4 times, right? Then you're going to have to miss work. You're going to have transportation to get there. So it's really important that to prevent yourself from getting bitten, having a rabies exposure, because this is a very long process that can also be expensive. So I talked a little bit more about what pre-exposure vaccination is, right? So what's the purpose of being pre-vaccinated if you work with animals, and should you get it, right? So the purpose of pre-vaccinations, unlike other vaccines, right, where if you get vaccines, you think like it's going to protect me from this disease. For rabies, it's not exactly like that. So the main purpose of being pre-vaccinated is because it simplifies the post-exposure process, right? So if you weren't vaccinated, you're going to need this whole thing. If you are pre-vaccinated, you no longer need the immunoglobulin, right? You only need a vaccine on day 0 and day 3. And so that simplifies a lot of things, right? Now you only need to go twice and you don't need to get the immune globulin. And the purpose of it is because it really primes your immune system to remember it. So if you do have an exposure to rabies and you get those 2 rabies vaccines, your antibodies are going to go sky high because your body's going to be like, I remember this. I was pre-vaccinated for this. And it's important to know that unlike other vaccines, pre-vaccinations maybe offer protection, only maybe, right? CDC actually says like pre-exposure vaccinations does not eliminate the need for post-exposure. However, it does simplify the schedule, and but there's no proof that it's actually going to offer you protection. So if you are pre-vaccinated and you have an exposure, you still need to get post-exposure. And why is that? It's because there's no actual protective antibody that's been established for rabies, just a minimum acceptable antibody titer. So who should actually be pre-vaccinated for rabies? So there is guidance on it. So in general, the big groups would be like rabies researchers or laboratory staff, persons who frequently handle bats, wildlife, rehabbers, biologists, veterinary staff, animal control, and people who work with animals in general. I think definitely talking to your healthcare provider about it will help make those decisions of whether or not you should be vaccinated, but always a consideration if you work with animals. And then how about for just people who are traveling to, countries that are endemic for for dog rabies? It's generally not recommended for the general population. It could be indicated for travelers who are going to these rabies endemic countries that have an elevated risk of being exposed to rabies, or if you're in an area where if you do have an exposure, getting post-exposure will be really difficult to obtain, right? So being pre-exposed does buy you some time. And this is the CE code. And just wanted to thank everyone for their time. And I wanted to leave time for questions as well.
Okay. So thank you, Michelle. That was really good. Dr. Chang. Okay, so I've got a few questions in the chat, so I'll just kind of go down the list and kind of touch them. Sabine says, if I was vaccinated, including a booster for rabies 12 years ago, am I still protected?
So if you have another rabies, so that's another thing. So before the new recommendations, veterinarians were supposed to, and most people who are pre-vaccinated, that are not like laboratory people who work with rabies, we were supposed to get our titers done every 2 years. I still get that done because I do work with animals that have rabies. I think it is important for people to stay on top of their titers to just make sure that, they don't need a booster. So you are still considered pre-vaccinated. However, if you do have another rabies exposure, you are going to need two more vaccines.
Okay. Next question. If a person is bitten by a dog without proof of the rabies vaccination, is there any reason for concern given the canine rabies variant has been eradicated from the US?
Yeah, so there's still concern because in the United States, we always have, like, even in California, we do have dogs and cats every year that do end up getting rabies. And that's because they are getting rabies from those other wildlife, right? If you think about like skunks, foxes, raccoons, they're very peri-domestic, right? They are going to go into your backyard if you leave water and food out there, and they will get into fights with your dogs and your cats. So even if a dog is vaccinated for rabies and up to date on their rabies vaccine, if they get into a fight with a raccoon and you cannot test that raccoon and rule out rabies, that dog, even if up to date with their rabies vaccine, should still undergo a rabies quarantine, right? We still want to watch to make sure that that dog doesn't get it. That dog should get a booster vaccine as well, just to, protect it. So even though the canine rabies variant has been eradicated, we still have sources of rabies that will get into dogs and cats just because all these animals are still peri-domestic. So that's why it's still important to watch. And then there have been multiple cases where, like, there was a case a couple years ago where these puppies that came from Texas ended up going to a rescue in Colorado, and one of the puppies ended up being rabid, and then multiple other puppies ended up being rabid, and it was because they did have contact with a rabid skunk in Texas before they went into Colorado. And then there was another case recently, like in Chicago as well, of like a local rescue that was brought from a different state and went into that state, and that dog ended up having rabies. So mammals here, anything that bites you, it's still fair game. And that's why we have quarantines, and we'll do quarantines instead of euthanizing pets, right? Because we're going to watch these animals. And there's different risks for things, but the risk is not zero.
Perfect. And then, hey, Michelle, Dr. Chang, could you just leave the CEU code up again?
Sure. I'm just going to put it in the chat. It's CC260070. So let me just copy and paste this into the chat.
Thank you, Sammy. Okay, we got it in there. You're good.
Okay.
Okay. Next question. Do you think it's safe for boarding facilities to accept rabies titers in lieu of current vaccinations? And if so, do you recommend following the WHO's recommendations of minimum zero point 0.5 IU milliliters antibody level?
Yeah. So accepting titers in lieu of vaccination, that is something that your state either accepts or doesn't. From a scientific standpoint, though, there is no proven titer that shows that is protective against rabies, right? And that's the same for humans as well. It's just a minimum acceptable level. It means that, like, a dog did react to the rabies vaccine. Dogs that have an acceptable, animals that have an acceptable level that were exposed to rabies, it's not guaranteed that they are going to be protected, right? So I think having a current rabies vaccine is very important, but also taking into account what your state laws are and what your business looks like, and what happens, right? Always think about what happens if an animal does end up being rabid. You're going to have to contact trace every situation where that dog could have played with other dogs, right? And like, it's going to be a lot of work for you to do these lists, and they're going to be asked for it. So make decisions that are good for your business as well. I think it's important that dogs are up to date with their rabies vaccines, but I think it's very different in each place, each state. It's different, and what the rabies situation looks like in your area.
All right, perfect. Next one, it just seems like it's a statement. Sammy said, we have all of our employees vaccinated through the county's occupational health center. The cost is much better than going through the hospital or doctor's office. And to note, she said they also get a discount on their professional liability and workers' comp insurance for doing this. Now I have a question, I guess. I don't know. I guess would that be a good question to ask my occupational health center is like, do you guys offer the rabies vaccine where I can get my staff vaccinated for it?
Yeah, it's very different so like Los Angeles County doesn't have that, right? Like you have to go to a hospital to do it. Some people will like team up with a pharmacy, like a pharmacy could order it for you guys, but I don't know how like the insurance works and how much it would be, but you would want to ask in your specific region.
Okay. Awesome. That makes sense. Cool. That's all the questions I have in the chat. Does anybody have any questions? Sammy, I see you've got a hand raised, but I don't know if you meant to do
I
that.
did. I'll just add in there to my note about the occupational health center. That's what I would recommend is just reaching out to your local occupational health center. To note, they're still very expensive. It's still $400 a vaccine with a series of two for pre-exposure in Virginia, plus their office fees, but it is way less than going to the hospital or a private physician. Um, I will note that this is just a cautionary tale for everyone. I'm both a boarding facility and a 35 full-time equivalent veterinary hospital, emergency hospital in Virginia. And we see wildlife or strays and things like that. We work with the county. We had a kitten about 10 years ago that was brought in by a Good Samaritan who seemingly had been hit by a car, had a broken femur. So we did the corrective procedures and kept it in hospital, but it was under 12 weeks of age. So it had not been vaccinated yet. We waited until 12 weeks, administered the rabies vaccine right at 12 weeks, and within 24 hours, that kitten was showing symptoms of rabies, the rage stage, unfortunately. It was absolutely horrific to see. Um, just as horrific, though, was that 75%, or I'm sorry, 75 staff members were considered exposed by the county. And only about 75% of those 75 people were vaccinated pre-exposure because this was an adorable little kitten that was in our hospital. Every single CSR, every single assistant wanted to squish on it, every manager. And so all of these 75 staff members had to go receive post-exposure prophylaxis. And it cost us cost our insurance about $1.5 million, $1.5 million in healthcare. And of course, we were dropped from that insurance, and it has been difficult or was difficult. We're fine now, but to gain insurance after that. So luckily, no one got rabies because it was all handled well, but it was certainly an overwhelming situation for our county, for our local hospitals. Um, thank goodness they had enough of the vaccine because, like I said, I'm in Virginia, and we have quite a bit of rabies here. So, but cautionary tale for everybody.
Oh, wow. All right. It looks like there is one more, another question, Marantha. In one of the slides, it stated it's not contagious till the animal is showing symptoms.
Yeah, so in the studies that they've showed that rabies is contagious only a few days before animals are symptomatic. Another thing with like symptomatic, right? Like us as humans, I don't think we're as good as looking at when things for subtle things before like your overt symptoms, but that's the purpose of that 10-day quarantine when they bite humans, right? It will cover because rabies is so progressive. It will be contagious just a few days before they become very overtly symptomatic, where you're like, whoa. And I'm sure, Sammy, you saw that too, right? Where it was like, it's okay, it's not super obvious. And then it went from not super obvious to like, this is very obvious, right? And that's why it's really important that the most important question you ask is, where is that biting animal right now, right? Because if you could have monitored it for a whole time, you're going to be able to be like, okay, you went from maybe to like you definitely are, and now you know what to finish that quarantine. So most animals that have rabies, for you to finish quarantine and not have rabies, it means by day 10, you're super healthy still, you're eating and drinking. That cat, for example, that Sammy was talking about, it was not going to survive 10 days. Like it's so progressive that like each hour it's getting worse to the point that it will be very clear that euthanasia is going to be the most caring decision to make and the best decision. So while yes, they can be shedding it in their virus, can be shedding the virus in their saliva, but only a few days before they show full-blown symptoms. So that quarantine is very important.
Well, perfect. I thought this was very informative and very it was very good, very detailed. Loved it. Hope everyone else did too. Dr. Chang, do you have any closing notes, anything? Anybody else have any questions before we go ahead and sign off?
And I would just recommend everyone like look up where you work and like who's your rabies control authority, because if you could make a good relationship with them too, right? They can give you more information. People are always scared to report because they're like, "Oh, I'm scared if I report my client, like they're going to take away their animal." Like so for example, in Los Angeles, we really don't have room in our shelters. We don't They're home quarantines, right? Where we want you to watch your animal. That may not be true in some of these places, but ask and not assume, right? Get the correct information that you can give your clients as well.
Now we actually just updated. I am in Kentucky and about an hour from Nashville. And one of our clients actually, their dog bit one of my staff members, and they we reported it and like went to the doctor. They ended up doing the home quarantine for, I think they checked in after 7 days and they did 14 days and then they were cleared. But yeah, it's really good to know what's going to happen because they actually called the health department, called the owners, talked to the owners about all this stuff. And the owners kind of called us because they were freaked out thinking that their dog was going to be gone. They panicked. And I was like, "Hey, no, like this is just how what happens." Because I feel like a lot of people won't go to the doctor because they're worried about what's going to happen to the pet and everything like that. So, yeah, definitely being informed of your area.
I'm happy to share our bite. We have a very good SOP for bite protocol now, and I'm happy to share that with anyone that's interested. If you just email us at info@paxcert.org, I would gladly share that with anyone that's interested. You're welcome to copy it and make it your own.
Well, perfect. Well, I'm going to go ahead and stop recording.